All right, welcome. Hi, I'm Melanie from Joy Health and Wellness, and sitting next to me is Dr. Julie Anderson from Simplicity Health.
Hello.
And she has agreed to share some wisdom with us today. I have some questions for her. And I met Julie through some mutual acquaintances that we had. And when I'm working with my clients, Simplicity Health is my #1 resource that I send people if they need any type of doctoring whatsoever, because I know they'll be in great hands. So, yes, of course. So can you give us a little bit of history on Simplicity Health and how you came to be?
I've been a family physician in the community since 2004, and I take care of the full spectrum of patients from birth to the elderly. And it's a passion. I really enjoy taking care of each and every one of my patients. And after about 12 years in serving in a large corporate setting with other partners, I chose to kind of swim against the current, so to speak, and start my own practice about a year ago now.
Awesome. I know that if you haven't been to Simplicity Health, one of the things that I love about it is it's not what I would say maybe your typical setting. I mean, you walk in and there's positivity sayings everywhere. It's very pretty. And I noticed like in the waiting room, I don't know what the technical term would be, if it's like creed or whatever, but I mean, I think one of the first things on there is like, I treat people, not disease, or something like that.
Yeah.
And I just think that's so important, because we are people in community. We're not diseases or titles per se. So awesome.
I think I was probably born in the wrong century, because I feel like I was one of those doctors that should have been practicing maybe in the late 1800s or 1900s, when you're traveling around to people's homes and just that whole hometown mentality, feeling like you're in a small community and your doctor by name, and you run into them in the grocery store, and be able to have that camaraderie. I think it's important for for patient care, because so much of what we do, especially in primary care, is connection with our patients. It's not about just okay, this is a specific illness and we're treating it this way. Yes, we do that, but a lot of what we do is more about in the context of how are you overall, how is your health, and how is your wellness.
Yes, that's amazing. So what would you want, what's the #1 thing you would want your patients to know when they come here?
Well, I think it's important to know what we do. We do see men and women, boys and girls. We do, as family physicians, we can really treat 90% of usually what comes in the door, and to realize that we are really interested, especially here at this clinic, in cost containment, efficiency, but quality, but being acknowledging the fact that many of us have really high deductibles. We've gotten to a situation where folks tend to fear their bill more than their illness sometimes, and I think that is creating a problem where folks don't get care. And so I feel like we need to step up as physicians and be a part of that discussion. So I try to make that a part of my interactions with people.
That's awesome. And that's something very different. Like my knowledge, there's no other clinic in the area that does that. Can you think of anything?
No, I mean, it's just been a growing passion as I've noticed that, people try to, people usually get their preventive visit covered by their insurance, and we're happy to do that for folks. But the problem that happens is people try to cram all their concerns and problems into one visit, and that's fine. I'll try to take care of them, but it's often not feasible for us to do all of that. So how do we make it that it's affordable, but you still are getting all of your questions answered, so that you don't have to worry about it? That creates anxieties, and and can sometimes make illnesses worse if you don't get answers right away.
Sure, absolutely. So when it comes to, you talk about like the overall big wellness picture, is there one area of wellness that you think people need to like pay attention to more or wish they would?
Well, I think, in my wheelhouse, it's about prevention. It's about, treating things before they become a problem. Weight is one that comes to mind. How do we help the ever increasing waistline of our country,
Right.
because that leads to increased risk of cancer, increased risk of heart disease, all of arthritis in the knees and the hips and needing new replacements. And so how do we have conversations about that before it becomes such a problem that it's really hard to manage?
Sure.
So coming in for, our wellness checks, making sure our blood pressure is under good control, making sure that we're getting our vaccines that are recommended to protect us from, disease.
Right. So when it comes to preventative care, what's the, if we could only do one thing, what would you say to do for preventative care?
Well, there's actually two things that have really been proven in medicine to both be cost effective from a population standpoint, not maybe from an individual standpoint, but from a population standpoint, that have been cost effective and have proven to be helpful, and that is vaccinations and also prenatal vitamins for prenatal care. So, but I mean, beyond that, if I had to pick one thing, I think it's taking care of your mental health, because it's, I think it drives the bus, so to speak. It's always present, and I think it's something that we don't always want to talk about or acknowledge, and it feeds so many of our other medical conditions.
When it comes to mental health, like what are your top kind of suggestions for patients to do when it comes to mental health?
Well, I think making sure you exercise is helpful. I know personally, if I just go for a walk every day, I feel so much better.
Right. Yes, absolutely.
And it's tough some days, especially in the winter here, to get out, but it does help. And I would say, trying to eat healthy, foods, and try to limit the amount of caffeine and junk food, because that can stimulate, our bodies in different ways.
And I think a lot of people don't make that connection, that the food that you're putting in your body has a direct connection to your mental health. I mean, like your gut and your food choices can play such a huge role in both mental and physical health. So I'm glad that you brought that up.
And I would say, even though this is being watched probably on electronic media, putting away our electronics, I have noticed just in the last decade that I've been a family physician that the amount of use of these things, I think has created a lot of anxiety, especially for our younger kiddos. And how we're going to have to figure out a way to balance the amount of information that we're constantly being fed and just living our lives. Because at the end of the day, what is this all about? Why are we here? It's probably more deep than you want to get into.
No, I totally agree. I have 4 kids myself, and 3 of them have cell phones, and it's a constant struggle of phone away, present. You don't need to answer that right now. Modeling that as a parent, putting my own phone away, and I don't need to answer that right now, because I think a lot of us have our work emails on our phone, or our social things, and just creating those those healthy boundaries of when to just be like, nope, enough is enough. So no, that's really good tips. And just going back to the immunizations really quick, forgive me if I'm wrong, but do you have something that you're offering right now for immunizations? Did I see that you have
Oh, it's it's flu shots. Flu shots this year.
All right,
This time of year is the big flu shot drive. So.
And to make their flu shot, would they just call to make an appointment? Okay, perfect.
Yeah. Most people don't know that. I mean, it was back in 1918, but there was an enormous flu epidemic. It ended up costing more lives than all of the world wars combined.
Wow.
Just in that 1 year. And granted, we've changed things, like we know to wash our hands, we know to cover our cough, we know to not expose ourselves to other people. So we've learned a lot of things along the way that have reduced our, the amount of flu outbreaks. But some strains can be really, really tough on people, especially people that are at the extremes of age, we call it. So younger than 5 and older than 65. So for those people and pregnant women especially, it's recommended get a flu shot every year.
And just for people that maybe haven't done that, I mean, what would that appointment look like? Is it just an appointment or?
Yep. Yeah, it's just a nurse visit. So we try to be respectful of time. We try to be respectful of cost. It's not necessary to have a doctor's visit with a flu shot if that's all you're after. And there are many places in town that offer them as well that are covered by insurance typically.
That's good to know, because I know sometimes that can be a sensitive topic or kind of a hot button for some people.
Yeah.
But just I wanted people to be aware when you're looking at, again, my passion is that whole wellness part. And if you're truly looking at that preventative piece, that's what's recommended. And so just wanting to share that with you as well.
And I will say that for the folks that are nervous about vaccines, currently there's none of the vaccines that we have in our office have any thimerosal or any mercury, or they have made them extremely safe for consumption.
So yeah, just do your research or ask questions. I mean, I guess would be my biggest.
Just even having conversations. I have patients that don't vaccinate, and I do just tell them what I know. I'm not I'm an expert in medicine, but I'm first to recognize that I don't know everything about everything. And so I think an important piece of the conversation, especially around vaccines, is just to be open to conversation about it, listen, and understand each other. And if we part ways, I'm not vaccinating, I'm not going to refuse to see patients because of that. I know some people do in town.
Good to know. Thanks. So then when we're talking about like kids and families beyond the mental health and the vaccinations, what do you feel is something else that moms could do to help keep their families healthy, especially in this we're getting back to school, germ seasons come in. Any other tips for us?
I think some of those germs are just going to happen, especially as you get back to school. Yes. I know my son just came home with it. So, and our bodies typically take care of them if we're exercising, if we're eating healthy, we're getting enough rest at night. I think knowing what I get a lot of questions about fevers, and a lot of people get nervous when their kid has a temp. And most of the time, a fever is a good thing. It's our body's response to an infection and fighting it off. And it means that we have a robust immune system. And so it's important to know that, from my standpoint, the temperature number doesn't really matter. I get calls about 104 temps in kids, and that's pretty normal for kids to have temps that high. And it often can be a virus that causes that. So it doesn't necessarily mean that it's worrisome. Certainly something to call in about, but just to recognize that that's often, just part of the illness.
Your body's working through it, and this is how it's supposed to work.
So what is the most, what do you think the concern is with fever? Why do parents get worried about fevers?
I'm trying to think back for my own, because I can remember I went 104, I'm that mom, I've done that call. And I guess I worry about a seizure happening with a high fever.
That's what most people do. And most febrile seizures start at 9.
Really?
Yeah.
So I would have never guessed that. And then
I usually tell people that because that's usually the first thing on everybody's mind is, oh my gosh, my kid's having a seizure. And by the way, if they do, it's not the end of the world. Most of kids do fine. They are not at risk for, for future seizures or, any problems like that. It's just related to temp, but it's usually at 99. So the number doesn't matter.
Okay, really good to know. I did not know that. Yeah. I'm just looking at these other questions too. Is there anything else that you would want your patients to know about Simplicity Health, or you in general, when it comes to taking care of themselves?
Well, we are, I know there's a lot of folks without primary care, and we believe it's important to have somebody that you trust. I always call family docs the healthcare navigators of the 21st century, because I feel like we're here, we have the expertise to help navigate, especially through complicated problems. Sometimes people come in, they've seen 3 or 4 specialists, but they really don't understand, what's going on. And I can kind of put it usually in layman's terms, so to speak, so that you have a better understanding, so you can move forward with your family or your personal issue and be able to make informed decisions. So I think that's what we in primary care do best, is kind of sorting out, what can we do here? What do we need to send you off to an expert about? Is it something that is something that's just going to go away and don't worry about it? Some people just need reassurance, and I think that's where our training comes in handy.
That's awesome. And I love that. I mean, that's part of your name. I mean, Simplicity Health, it's like taking that complication and scariness out of your health concern, but yet being supported every step in the way, so you can move forward and live that life that you are meant to live. And so I think that's awesome. And even your logo is beautiful. And I think, did you have like jewelry made out of that? Is that correct?
Yes.
It's so pretty. You guys, you should go on their Facebook page and see the picture, because you can tell the story. Was that a gift?
It was my husband, actually. So my physician assistant, Kalina, a stylist that works with me, she helped kind of design, and then we had another company help us to design it, finalize it, we'll say. And then one of my patients is a jeweler in town, and so
very cool.
My husband, without knowing, he brought it in, and she put it on a CAD computer program and was able to design it. So it's lovely.
And then, if I may, is this like your own desk area?
Yeah, this is it.
Can I show them what your sign says, the Choose Joy sign?
Oh, sure.
Okay. Yeah, so it's a sign, you guys. So Joy Health and Wellness, it says Choose Joy, and it's right at her desk that she sees every day. So I think that is just so cool. Thank you for sharing that. Oh, I love it. So if they wanted to see you or make an appointment or come in, what's their best way to get a hold?
Well, our website is www.simplicityhealthmn.com.
Okay.
Our phone number is 320-227-5000. We try to make it simple.
Perfect. I love
Everything here is trying to be simple.
I love it.
Because I was tired of not being simple. And then we also are on Epic. So if you are in another clinic in town, we have access. We have the same electronic record as most clinics in town.
Nice.
So you don't have to transfer records or anything like that. Again, trying to keep it simple.
I love it. I love it. All right. Well, that's everything I have, unless you wanted to add anything more. All right. Well, thank you. Yes, of course. Yep. We'll talk to everybody later. Bye.